There's a saying that disease well known is half cured. If we understand the symptoms, if there's a social awareness, and if we know the medications to treat them, most diseases are likely to be well treated. However, this particular disease does not. Despite our understanding of its symptoms, appearance, or potential treatments, we can't cure it. This is because it predominantly affects the most marginalized populations where access to medications and educations are severely limited. Hi, this is Sehee Kim, a rising senior from Healthyi organizations, and let me introduce you the NTDs. NTDs, short for neglected tropical disease, is a diverse group of infectious disease that thrive in tropical and subtropical environments. These diseases cause severe pain, lifelong disabilities, devastating conditions, and socioeconomic consequences. Currently, they affect more than 1.7 billion people worldwide, primarily in poorest countries, conflict zones, and hard-to-reach regions where access to safe water, sanitizations, and basic public health services is unavailable. In fact, according to the World Bank study, 51% of the population in sub-Saharan Africa, the major focus for NTD, lives on less than $1.25 per day, and 73% of the population lives on less than $2 per day. As these numbers consist more than the populations of Europe, it marks the urgency and severity of this issue. Just like what I've mentioned before, the NTDs are the group of diverse disease, which suggests that individual diseases are very different from each other, and one person can be affected by more than one disease at the same time. But, for the pragmatic point of view, the World Health Organization classified NTDs into two groups based on the availability of the medications. First, the preventive chemotherapy and transmissions control PCT NTDs, and innovative and intensified disease management IDM NTDs. PCT includes diseases that are usually treated with safe and inexpensive drugs such as soil-transmitted helminthiasis and lymphatic filariasis, whereas IDM includes NTDs that currently lack appropriate tools for large-scale usage such as biliary ulcer and Chagas disease. There are currently 20 diseases classified as NTDs, and the number is increasing after COVID-19 pandemic. Let's look deeper into some of these diseases and understand how they affect our health. For soil-transmitted helminthiasis (STH), intestinal nematodes, the different species of parasitic worm that usually live in a contaminated soil, infects human. When you get a direct touch with these worms' eggs, then these eggs hatch into a larva in your intestines, allowing them to migrate through your bloodstream to your throat. These causes pain, diarrhea, and nausea. Worse, it leads to cognitive impairment, retardations, malnutritions, and even death. At this point of the video, you might wonder, okay, now I get how NTDs severely affect people and how it's dangerous, but why are they called neglected and why is it especially important? The answer to this question is that related to further challenges that NTDs face. NTDs are the result of poverty. They not only worsen one's health, but also perpetuates the cycle of poverty and stigma. Hinder. It hinders economic productivity as it limits peoples with NTDs to perform economic and social role within the family and community, to work, to undertake farming practice or several activities for survival. Impair. It also impairs the development of the children and people's health because of the cost of inappropriate treatments, creating the cycle of poor health. Reduce. It also reduces the educational opportunities as children must act as a caregiver for their parents, creating the generations of people with little or no educations, also leading to the depressions or poor mental health of the caregiver. Even though NTDs cause a vicious cycle of poor health and economy, they are almost absent from global health agenda. Even today, when focus is on the universal health coverage, NTDs have limited resources and funding. Worse, because of the COVID-19 pandemic and an increased climate change, many NTD treatments and prevention programs were disrupted or halted. Mass drug administration's campaigns and research funding has also faced significant delays. In fact, 400 million fewer people received interventions against NTDs compared to pre-COVID-19 levels, which makes a significant decline. At the 17th World Health Assembly in 2017, the resolutions was adopted on a global vector control response that aims to prevent, detect, report, and respond to outbreaks of diseases worldwide through the comprehensive approach. The World Health Organization also launched the NTD Roadmap to 2021 to 2030, aiming to improve its well-being by 2030. It reduces the poverty due to the NTDs by supporting the UHC and launching MDAs. Apart from the governmental efforts, there are many private organizations including the END Fund, the NNN, and the World NTD Day who helps to reduce the impacts of NTDs. They deliver medications, improve water conditions, and create public health programs. Healthyi also works ferociously to help people with NTDs. Healthyi is a student-led organization so determined to initiate shipments of medications including albendazole to reverse the impacts of NTDs in major locations such as Nigeria and Rwanda. We not only distribute crucial medicines, but our mission is to stand beyond its distributions. We work together to empower impoverished communities by providing additional educational opportunities and committing our communities to build up a solid understanding of NTDs. To support and follow more of our actions, you can visit healthyico.com. NTD needs attention and your attention. By prioritizing NTDs, we not only elevate the sufferings of those affected, but also contribute to the broader global health and economic stability. Together, we can work towards a future where these diseases are no longer called neglected. Thank you.